What causes a child's fever? The role of cytokines and pyrogens. Imagine your child's body fighting off an infection and suddenly their temperature rises. What exactly causes that fever? Let's explore how the immune system creates this common response. When a child gets sick, their body reacts by releasing special substances called pyrogens and cytokines. Pyrogens are agents that trigger fever and can come from outside sources like bacteria, viruses, or toxins. These are called exogenous pyrogens because they originate outside the body. When these external agents invade, they stimulate immune cells to produce internal pyrogens, which are called endogenous pyrogens. These include cytokines such as interleukin-1, tumor necrosis factor alpha, interleukin-6, and interferons. These cytokines act as messengers, signaling the brain that the body is under attack. They target a part of the brain called the hypothalamus, which controls body temperature. The cytokines tell the hypothalamus to produce a substance called prostaglandin E2. This molecule raises the body's temperature set point, meaning the brain thinks the normal temperature is now higher. To reach this new set point, the body responds by generating heat through shivering and constricting blood vessels to keep heat in. This process causes the child's temperature to rise, which we see as a fever. From a pediatrician's point of view, understanding this process is important because fever is part of the body's defense system. The increased temperature helps immune cells work better, especially B and T lymphocytes, which fight infection. Usually, a moderate fever around 39.5 degrees Celsius is beneficial. The body's temperature regulation is controlled by the central nervous system, which prevents it from rising too high. Sometimes, though, the immune response produces too many cytokines, leading to excessive inflammation. This can happen in severe infections or septic shock, which is a dangerous condition. Cytokines influence the hypothalamus in two main ways. One is indirect, where they stimulate nearby cells to release prostaglandin E2. The other is direct, where cytokines cross the blood-brain barrier and act directly on brain cells. Some cytokines can cause fever without involving prostaglandins, especially in infections of the brain or injuries. Knowing how cytokines and pyrogens work helps pediatricians decide when to treat a fever and when to watch closely. Fever itself can be protective, but very high or persistent fevers may signal serious illness. Medications called antipyretics work by blocking prostaglandin production, helping lower the fever. In summary, a child's fever results from the immune system releasing cytokines in response to infection or inflammation. These cytokines act on the hypothalamus to raise body temperature, helping the body fight off illness. Pediatric care involves balancing the benefits of fever with the need to keep your child comfortable and safe from complications.